Okay, so we're here with Caroline, and we are going to now test some strength around the hip. So there's two different types of tests or assessments that we're going to do today. The first is a manual muscle test, and so what we're going to do is do hip flexion. And so when doing manual muscle testing, before applying any external or manual resistance from the physical therapist, it's a really good idea just to make sure that there's a good active range of motion that they can produce on their own without any pain, any irritability, and so forth. So Caroline, for hip flexion, what I want you to do is simply just kind of bend your knee back towards your chest as far as you can, nice and controlled. Go ahead, right side, good. And back down again. Awesome. Any pain or discomfort? No. Good. Just totally relax your right leg. Try and go dead fish on me for me. And I'm going to bring you into the same range of motion. Good. Any pain or anything like that? Okay. So for a manual muscle test, what we're going to do, different joints or assessments might go through kind of different ranges of motion on where you're going to test them. For the hip, it's a really good idea to go to standardized 90 degrees. And so what we're going to do, Caroline, is bring your knee right to 90 degrees. Good, so hold it right there, nice and relaxed. I want you to try and stay neutral, right? Try not to turn in or out, okay? I'm gonna stabilize your hip right here with my right hand, okay? And I'm gonna say, not yet, but I'm gonna say go, and then push, push, push. Each time I'm gonna get harder, harder, and harder, okay? And I want you to try and resist me and don't let me break you down. Okay, ready, and go. Push, 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 and rest. Good. So with maximal resistance, Caroline was still able to withstand my resistance, and so she would score a 5 on a manual muscle test. If we wanted to get a bit more objective, we could use a device called a handheld dynamometer. And so we're going to do that, but we'll do a different test. And so Caroline, what I want you to do is pop up here for me, and we'll test her external rotation. And so good. And so we'll test the right-hand side for external rotation. Because they're going to be kind of swinging that foot medially, let's just get the left hip out of the way here. Good. And so I want you to sit up nice and tall. Just go hands on your hips to start. Good. And you play soccer, right? So just like an inside volley, I want you to keep this leg, this thigh on the ground, but I want you to bring the inside of your foot as high as you can towards this direction. Good. Up towards the ceiling. Good. And so we see that her active range of motion is, 45, maybe 50 degrees. And so for that one, what we're going to do is go around half the way of her active range of motion, and we'll test her isometric strength in that position. So we have what is called, again, a handheld dynamometer. The best part about it is we can get objective feedback, and you can produce or report the force output in pounds, in newtons, etc., depending on which unit you would like to use. But for external rotation, what we're going to do is we're going to use the landmark of the medial malleolus. So go ahead and just relax. So we'll palpate that obvious bony structure on the medial side of the ankle, and we'll come just superior to that, okay? Caroline, the instructions for this one are going to be a little bit different, okay? On the first go, again, we're going to pull you into about 20 to 25 degrees right there. I'm going to say go. I want you to engage with me, okay? And then I'm going to say 1, 2, 3, 4, and 5. On go, on 1 and on 2, I want you to kind of build from 50% to 100%. And then from 3, 4, and 5, I want you to give me 100% and give me as much force as you can. All right, sound good? So let's go hands on your hips. Good. I'm going to stabilize her distal part of her femur, all right, to help her kind of create and reproduce that force. Good, so hold right about there. Good, we're going to make sure that we have the right leg. So we have the right leg being tested. We select right leg on the test. And you can always just make sure that you zero out your device just like you would any other scale. Okay, so right above the medial malleolus, right there. Okay, so again, it's going to be not yet, but it's going to be ready. And then, sorry, it's going to be go, and then 1, 2, 3, 4, 5, okay? Okay, so ready and go. 1, 2, 3, 4, 5. Rest. Good. And so it's really, really important that my resistance is, next slide. Make sure we got a number. Yep, good. So it's really important that my resistance is at least matching hers, or I shouldn't say at least. It shouldn't be less or more because we want that contraction to be isometric. So there shouldn't be any range of motion occurring during the contraction. And again, objective feedback is really, really good for different populations. But if you want to be really objective throughout maybe a longer term rehab type process, or help your athletes or clients or patients return to a specific goal, this is really, really good to help track that, but also to help motivate them as well along the journey.